Namaskar. Very warm welcome to all our viewers and learners in this live phone-in session of CIT and CRT. I am Renu Bhatt with you all, and you are watching us live on eVidya channels from channel number 6 to 12 and on our NCRT official YouTube channel as well. Dear learners and viewers, this is our special session of Sahyog where we talk about students' mental well-being and we try to provide them psychosocial support as well. And the topic for the discussion today is contemporary issues of adolescence, and we know that there are so many issues related to adolescent periods. What are they and what are the solution of that? We will let us know by our experts. Let's meet them. You are Dr. T.V. Somashekhar. You are faculty from RIE Mysuru NCRT. Very warm welcome, sir. And we have our another expert, practicing counselor, Dr. Bharati Kulashekara. Ma'am, very warm welcome.
Thank you. Namaste.
And before we begin this session, let me give some important information to all our viewers and learners in case they want to participate in this live phone-in session. Dear learners, you can call us on our telephone number, that is 8800 Either you can drop a mail at our email address, that is sahyog.ncert@cit.nic.in. And if you are joined us through our live streaming, that means you are on our NCRT official YouTube channel. You have to go to the live chat box and drop your comment out there. Our expert will be happy to answer all your queries and doubts. If you have any experience, you want to share your experience with our experts, feel free to connect to us. So let's begin this session from you, sir. And my first question to you is, what are the contemporary challenges of adolescence? Sir, please explain to all our viewers and learners, sir.
Yes. Now, the adolescent are being facing the challenges over a period of time. As we know, in human development, the growth and development of human growth, it is a transitional period from childhood to adulthood period. So since it is a transition, so it is in a turbulence state, and how the individual deals with this context is very important. And it changes from time to time. So these issues and these factors were persisting even in the previous years and decades. But now, as the new situations have changed, as the societal norms have changed, and social living patterns have changed, and the way in which learners are learning at school levels are changing. So therefore, there are issues, the same issues remains there, but it is taking a different shapes and different dimensions. So it is in that perspective we need to understand what are those contemporary changes that we are trying to see in the stages of adolescence. So prior to that, as we are aware of that, adolescence is a challenging period. It is for the adolescent themselves as well as to the parent to take care of them and to ensure that there is a smooth transition over a period of time. So therefore, it is a both challenge to the adolescent child as well as to the parents. And it is not an easy time for both of them, for both the child or the adolescent or the parents, because there are a lot of changes which is happening within the adolescent itself, and its consequence is felt in the home on the parent itself. So it is not a comfortable time for both of them. So it is the way, what is that, the way we can address this issue is to understand what is the need and problems of the adolescents at that particular stage, and then try to prepare ourselves to meet those challenges and to accommodate or to facilitate those kinds of needs to whatever extent that is possible in the present prevailing conditions. And now the learner, as we are trying to see that the learner is now in a different frame of mind. So here the parents, when they send their work to the schools, they want them not only to get educated, and it is through education, developing their own personality is taken a backstage. Now parents are also demanding many aspirations to be seen in their works, and therefore there is a lot of changes that is happening, and we can visualize those issues or challenges in the major factors. The first factor is the challenges that they face in terms of the physical changes the adolescent has, they are undergoing during that transition period. And why this is happening? It is because of the biological hormonal changes that happens within the body system. So it is these changes help them to see that the lot of changes that they are experiencing within their body, and how do they cope up with that internal changes with the external realities. And therefore, this gives them a conflicting situation. And in this stage, there is varieties of adrenal glands that are start functioning, and therefore there is hormonal imbalances or secretion of glands into the blood, and this leads to its own consequences. Whether it is extreme or whether it is low, hormone secretion also leads to different kinds of growth and development in human beings. So therefore, this is an important factor, and every individual should realize it is a natural changes, biological changes that is happening within the physiology of every human body. So that is what one has to accept and deal with it. The second that we are going to see is that because of hormonal secretion into the bloodstream, there is emotional development, outburst of emotions. So therefore, we can see that suddenly at this stage, adolescents develop the aggressiveness, and they show the extensive opposite behaviors which are not shown during the childhood period. So therefore, this becomes a major issue, and even the adolescents feel that is my emotional behavior, what they are presenting or showing at that moment was right or not, because they are in a doubtful, confusing situation that they are not completely transformed into an adult, or they are not completely into their childhood period. So it is in that turbulence they are trying to see how this emotional uh, developmental activity that is taking place within their body, within their mind, how they want to do it. And since there are emotional changes, this implies to their behaviors also. So that means here, what was appeared to be very soft behaviors earlier, now that is transforming itself into an aggressive behaviors. And these aggressive behaviors, the child imbibes by looking into various social contexts around it, in the school, at home, outside school situations, and he selects some of them as their icons or role models and try to emulate them and try to be like them. So it is these kinds of things that we are trying to see as a behavior changes. And since during the adolescent period, it is a stage for exploration and to satisfy their curiosity in whatever they try to see, which is fascinating, which is fantasy for them. So it is in that directions. So it is they are likely to use varieties of substance abuse. Maybe it is a drug addictions, or it is alcoholic, or it is any other things which they are likely to be exposed to, and they take it for having the experience as a first time experiences, but later on it may turn out to be the addictions, and it causes very good damage to their own personal health as well as their mental health. So that is these are the important issues that we have to look at it. And the next factor is we have to see the educational challenge. Now, education in the earlier days, there was no competitions among the learners, or the parents were not taking it, educating their wards as a prestige. Now they want their ward to acquire the highest level without realizing what is the child's own abilities and potentials. So these factors cannot be imbibed or forced externally to the child's abilities. So it has to come developed within the child itself. So is that parents are giving care to them, or they are only looking at their external?
Hello? Hello? I hope we are audible to you, sir. Dear learners and viewers, the topic that we are going to discuss today, we are discussing in this particular session is contemporary issues of adolescence. If you have any queries or you want to ask something from our expert, feel free to connect to us. You can call us on our telephone number, that is 8800 Either you can drop your comment at our on our YouTube channel, that is NCERT official. You have to go to the live chat box and you have to drop your comment out there. Either you can drop a mail at our email address, that is sahyog.ncert@ciit.nic.in. And let me try one more time to connect to our expert, Dr. TV Somashekhar. Are you there? Hello? Sir, are you there? Okay, fine. We'll move forward towards our next expert, to Dr. Bharati ma'am, as we have some network issue from Dr. Somashekhar side. Ma'am, we'll continue with this conversation. Would you like to add something, or I should ask you another question, ma'am? Would you like to add something, ma'am?
Yeah, yes. See, we know adolescence is normal part of development, but still they face lot of challenges. That is what the professor was discussing about. What are those challenges normally they experience during adolescence? Lots of physical changes, of course. We all know hormonal levels are high and maximum growth has to happen, and we just cannot bargain on that. But as a side effect, I would say, as a package, there are some challenges even physically. Girls get worried about their body shape, and then boys, they are worried about their changed voice. There is acne issue, menstruation issues. So these are all very normal. We just cannot help it.
But they are very much worried about their appearance, right?
Yes. But how are we going to help them out? That is the crucial question. The best way would be like explain it to them. It's normal, and every adolescent has to go through it. It is something like it's a group. Everyone is going through that. You are not alone in the boat. And then help them to get adapted to these changes. Once they acknowledge the change, it is very easy for them to accept it. And then we will have to keep them healthy, stay fit, by giving them nutritional diet, everything. So this is how we can handle these physical challenges that adolescents go through. When it comes to emotional challenges, it's a roller coaster ride. We all know that it is a roller coaster ride for both parent and the adolescents, and they're totally confused about their own role. They're overly emotional, crying, mood swings, inferiority, and there are a lot of questions about sexuality and sexual feelings. So again, it is normal. Today it is going to be my slogan. It is okay, it is normal. But they will have to be helped because their growth is not complete yet. Their brain development is not completed yet. That is why they need our support as parents and teachers and professionals. So we will have to encourage them to become more and more independent, so that they become confident to handle their emotional variations. We will have to keep on telling them it is okay. These fluctuations are very common and there is nothing abnormal about it. Most of the time, they struggle with guilt because of their own emotional expressions. And then, we will have to allow them to talk. We will have to listen to them instead of judging or criticizing, because they don't take it. And then, as much as possible, it is better to avoid giving advice, because they are not ready yet for all this. We can do one more thing. We can share our own experience as an adolescent, how our emotions used to work when we were adolescents, and then how we overcame it. And another method would be like encourage them for creative activities, so that this emotional energy is channelized, deviated, or well spent rather. So it is easy for them to handle their emotions. When it comes to behavior, as Professor Somshekhar said, every parent at some point of time think like, my child was an angel all these years. I don't know when did he or she turned into a devil. You asked me because I am also a mother of an adolescent. But again, it is normal part of development. And of course, we are worried about their behavioral variations rather than the challenges. They are very impulsive because of that excess emotion. And then again, it makes the life of the adolescent and the parent difficult. Again, we will have to remind ourselves that it is only a passing stage. Our child is not going to get stuck in this developmental stage forever. And it is entirely normal if there is a variation. So if at all we want to change the behavior of the adolescent, we will have to gain their trust first. Let them know that we love them, whatever they are, however they are.
Right.
That is very important. Many times adolescents think that parents hate us because of our behavior. No, we will have to make it very clear. Then we will have to encourage them to be truthful to themselves rather than pleasing or following others. And then One more thing we need to remember is that, as I mentioned earlier, they are not totally independent. So they are not able to deal with their own emotions independently. That is why they need our support. So we'll have to explain it to them that, or you can even suggest what exactly you would do when you go through such an emotion of sadness, depressive feelings, or negative emotions. But time to time, if at all we find extreme behaviors, we need to intervene. If they are especially into a bad company, they are all very sensitive. Adolescent population is very sensitive. So that is why they don't take criticism. That is why we will have to deal with it very sensibly. So when it comes to substance abuse, there is a lot of peer pressure, as professors have said. They want to follow somebody. There will be role models in their own group. If they don't behave like them, they are inferior to them. That is how exactly they think.
Right.
But we will have to keep an eye, keep watching them, observing them for any erratic behavior pattern, and then there is a change in appetite, sleep pattern is disturbed, and then their mood swings are more and more extreme. Instead of spying over them, we will have to encourage them to be honest. That's it. That's the only way. Talk about your concerns. Discuss about the problem, not about the adolescent. That is very important. And if they're not willing to open up with parents, definitely they need professional help. And even the treatment is necessary if they're really addicted to substance. And then when we come to educational challenge, we just cannot ignore this part at all, because there is a lot of pressure on them, taking a good score, getting into good institutions, and then peer pressure again, parental pressure. So we will have to support their aspiration rather than ours as parents, So encourage it. That would make the life more easier for them. And then, if at all, see, as parents, we want them to be more responsible even at home. We would have entrusted them with few, chores, household chores. Try to cut it down when your adolescent is under stress. If they're really overwhelmed with the daily activities, then in that case, we can cut a few, tasks as far as their challenges are concerned, and then be with them when they are really stressed out, and time to time you take a feedback from the school also with regard to their educational performance and all. Then another important area is health challenges. We all know they are very vulnerable because of their hectic schedule, their food habits, and eating disorders they get into during adolescence. So we will have to be very particular about a balanced diet, and very importantly, we will have to lead by example. As a family, if we are following a very good food culture, I wouldn't say food habit, it's a culture, it's an attitude, what we eat. And then healthy food, exercise, sleeping on time, especially not spending too much time on gadgets, will definitely improve their health issues. And then when we come to the psychological problems, we just cannot ignore it, because adolescents are even vulnerable as far as psychological issues are concerned. Their moodiness and temper tantrums are normal. Yes, again we can assure ourselves it is normal, but identifying the extreme symptoms is very important. Most of the time, I tell you, talking about the problem and maintaining a healthy communication and lifestyle with the adolescent normally prevent the onset of depression and anxiety. But if your adolescent is over moody, very cynical, very intensive issues, then we will have to intervene again. You will have to seek a professional help. Time to time, you will have to get a feedback from the school too. Many a times, adolescents behave differently in school. So their feedback will be very useful to decide on the psychological problems.
Right.
Don't brush away their feelings, because if we do it, it might worsen the problem. And then again, I stress upon this: communicate with your adolescent time to time, quite frequently, day-to-day basis, quantitatively, qualitatively. You can avoid many of psychological problems. Whenever I happen to counsel an adolescent, I could see all these drawbacks. That's why I'm stressing on that. Then most important thing I just would not want to forget is gadget addiction.
Right.
Because social media has changed the way we interact with people. It is not only with adolescents. It has happened to the entire human community, according to me.
Right.
Especially post-corona period, it has affected every individual's lifestyle the most, I would say. Texting, chatting, playing, talking, less social life, I would say that. Definitely with adolescents, it would end up with addiction too. So having a parental control is very important. Anyway, we cannot say no to internet. It doesn't solve the problem. They become more and more adamant by doing that. But instead of that, you can talk about the ill effects. We can talk about our concerns, why we are worried about extra gadget time. And one more problem normally happens is we just assume that our children are addicted because they spend too much of time on computer. It is not so. Sometimes they could be productive too. They might be surfing some good information with regard to their academic issues. So we will have to keep all these things in our mind and then guide them if necessary. But we cannot decide for them. We will have to, not forget about this. Over and above this, having lot of family activities, family interactions will definitely address this issue. At least they spend less time on computer, spend more time with us as parents. So that is also very important. In a nutshell, what I would say is, we need to understand the problem, we need to know, then only we can help. That is why the awareness is very important, what challenges our adolescents are going through. Because parents play an important role and we cannot ignore a teacher's role also. So educating them about the possible challenges or problems will have 50% of positive impact. And then to start with, understand their feelings first and then start giving the suggestions. It will definitely reduce the conflicts. So establishing a very friendly communication with your child will definitely encourage them to be more honest with you. Whenever they are in trouble, at least they approach you. So be empathetic. Empathy is very important. We will have to try to put our legs in their shoes. We need to understand what they are going through. See, these are all the simplest ways. We are trying.
At least we can try, ma'am,
rather than resolving it.
Right. At least we can try. So, dear learners and viewers, those were the contemporary challenges and those were the help that you can do as a parent and as a guardian. Ma'am, here we got a question from our viewer. Gajraj Meena is asking, how can we make their thinking with full of maturity as they are adolescents, ma'am?
Madam, can you repeat the question?
Yes, ma'am. Yes, ma'am. How can we make their thinking with full of maturity as they are adolescents, ma'am?
Yeah.
As they are yes, ma'am.
An adolescent is almost at the threshold of adulthood. See, many a times they behave like adults and many a times they they behave like children. As we all know, it is a transitional period.
Right.
You are talking about over maturity, isn't it? Most of the time it is because of their language capacity. That's what I believe. It is not about the maturity at all, because they are able to speak too well, and that vocabulary enrichment is too much because of the interaction and exposure. But as far as the development is concerned, they might have not understood everything. That is why it is very important to sit with them and talk to them, to understand their level of understanding. What exactly, how exactly they have understood their own developmental stage. That is very important.
Right. So, ma'am, we still have couple of more minutes with in this session. Would you like to add something on it? Any challenges would you like to talk upon, or any help that you would like to give to all our viewers and students, ma'am? Even though their parents and guardians as well.
Yes, can I come in?
Yes, sir.
Yes, yes.
So
Now we have to look at how the children are brought up at home. So the social environment is also one of the important factors there, and even the child rearing practices and the cultural environment that we provide at home has an influence on the adults' activities and developmental factors. Okay, so now we have single child parents also there. So even that also contributes to the emotional development of the child. Okay, and the urban localities doesn't have open spaces for children to play, and even playing outdoor games also promotes their physical development in a desired way, and depriving of them also to that extent deprives their physical developmental activities. Though we may say indoor games are there, we can play chess, we can play carom, we can play shuttle badminton, but still playing in group activity, learning the rules, following the rules, and following the group norms is also very important in society. So it is in that perspective, the way we are trying to bring up our children and the opportunities and experiences that we provide, and the way we want the child to look at the outside world and try to internalize it and try to make it as his own and deal effectively with those factors is also very, very important.
okay.
Now, accepting the challenges, accepting the success as well as the failure in the same stride is very much essential. If that is not given, if we are only encouraging only to accept the positive side, when the child faces the failure, then he looks at very extremely at the extreme end and try to take a very drastic measures or steps. So this needs to be looked at very carefully, and we should try to give those situations in which enables them to go in a very positive direction, considering both the aspects of the issues. So that is what is very essential in the current moment.
Exactly, and we are running very short of time right now, sir. We have to wind up this session here only, but thank you so very much for being with us. Thank you so very much, TV sir, and Bharati ma'am. Thank you so very much.
Thank you very much.
For your
information.
Yes, so for all your information and details, and thank you so very much, dear learners and viewers, for being with us and for your valuable comments. And me, Renu Bhatt, is taking your leave, but you stay tuned to eVidya channel or NCERT official YouTube channel for more informative programs. Namaskar.